طيب بسم الله والصلاة والسلام على رسول الله. The vision problems in session 5 divided the following: either to be transient loss of vision or acute loss of vision, or gradual loss of vision, or double vision, or dropping of the eyelids, and lastly gritty eye sensations. From where I will start like this. Hello, good morning. My name is Dr. Adam, one of the doctors in the clinic today. Nice to meet you. I have a letter from your GP stating that you have been troubled with vision problem. Can you tell me more about that? Here, focus بس in what he is going to talk. Can you tell me more about that? In this point, link your heart. Yes, it started suddenly to my eyes. I lost the vision for a few seconds, then I become okay. What is this? Transient loss of vision. Am I right? The second, no, yes, doctor. I lost the vision since yesterday till now. This is what? Acute loss of vision. Yes, doctor. I have loss of vision since around 6 months ago. This is what? Gradual loss of vision. Are you following me? I will link my heart to which types of vision problem I'm dealing with. According to this question, can you tell me more about that? Can you tell me more about that? Wallah, I lost the vision since around yesterday for around 20 seconds. Is that clear? But I will say to him, stop. This is transient loss of vision. Then all of them, there is fixed frame asking, what do you mean by vision loss exactly? I mean some curtain come down to my eye from up down, curtain. Then shift yourself to the second step. Which eye is affected? To know is it monoocular or biocular? This is the second W. The third W, which part of the vision is affected? How many W? 3. A 3D apply for all the vision problem, with exception of double vision. What do you mean by vision loss? Which eye is affected? Which part of the vision is affected? Which eye is affected? What do you mean by vision? Which eye is affected and which part of the vision is affected? Then I will say to him, thank you. You have transient loss of vision for differential diagnosis. Number 1 could be this patient having TIA. Could be this patient having Amrousis fugax. And this transient loss of vision because of as a part of TIA or inside the eye itself, Amrousis fugax. Or could be wallahi because of migraine or temporal arteritis, or could be because of hypoglycemia. I will ask him, Mr. Young, I understand that you have been troubled with vision problem. Yes, can you tell me more about that? Yes, I lost the vision for a few seconds. Then, what do you mean by vision loss? Which eye, which part? I don't know, left eye, but I don't know the part. Thank you. I will say to him, come here. During these few seconds, do you have any history of weakness at all anywhere in your body? Do you have any difficult of speech, dysarthria, any loss of sensation anywhere in your bodies? No, doctor, no, doctor. Bye TIA. Yani by this questions examiner, he understand that you ruled out TIA as a part of this what? Transient loss of vision. Second step, Mr. John, you said to me you lost vision for a few seconds. Yes. Can I ask you, you have no symptoms at this during these 2 seconds, stating that you have been transient loss of vision, but can I enter a TIA? Can I ask you please, do you have any risk factor for Amrousis fugax? You have transient ischemia to the eyes? Do you have any high blood pressure, high blood sugar, high cholesterol, heart racing up normal, any history of smoking? I will ask for all risk factors of ischemia by rule of H. High blood pressure, high blood sugar, high cholesterol, heart racing abnormal. Yes, doctor, I have AF. I have abnormal heart racing. Do you receive any medicine for that? Yes, I am receiving warfarin. Then bye-bye, Amrousis fugax, the patient having what? AF. Mr. John, can I ask you please, during these 10 seconds, where you lost the vision. Do you have any headache at all? No, doctor, I have no headache. Examiner, he will understand that by these questions of headache, you rule out migraine or temporal arthritis. Mr. John, during these 10 seconds where you lost the vision, do you have any hand shakes, hand sweating, feeling hungry, to rule out what? Hypoglycemia. Before I examine your jasad, what is your jasad? What is your job? Do you smoke? Do you drink alcohol? Do you drive? Yes, I need from you to stop the driving. Is that clear? If it is happening with him multiple attacks, I need to stop the driving for around 3 months. If no, say for him, I need to stop the driving until further assessment. Go, I'll examine him. Before I examine the patients, to summarize to you that the vision scenarios inside the basis divided into 3. The main 3. The remaining one is double vision and dropping of the eyelids. The main 3 is either transient loss of vision, acute loss of vision, or gradual loss of vision. Approach is same. I understand that you have been troubled with vision problem. Can you tell me more about that? To take for him whether this is transient, acute, or gradual. From the opening question. Yes, doctor, I lost the vision for a few seconds. This is transient. Yes, the vision. Yes, doctor, I lost the vision since yesterday till now, or since 3 days till now. This is what? Acute. Yes, doctor, I lost the vision since around 6 months. This is what? Gradual, am I right? Or something chronic. Then can I ask you www? What do you mean by vision loss exactly? Which eye is affected? Which part of the vision is affected? I don't know the part. Thank you. You give me transient loss of vision for differential there of TIA. Mr. John, during these few seconds, do you have any weakness anywhere in your body? Any loss of sensation? Difficult of speech? No. TIA, go away. Mr. John, any risk for Amrousis fugax? Do you have any heart racing abnormal? Any high blood pressure? Any high blood sugar? Any high cholesterol? Any history of smoking? Yes, doctor, I have abnormal heart racing. For that, I'm taking warfarin, and I have also high blood sugars. Mr. John, during these 10 seconds, do you have any headache at all? No, doctor, I have no temporal arthritis. I have no what? Migraine. Mr. John, during these 10 seconds, double H or triple H, any feeling hungry? Do you have any hand sweatings, any hand shakes, any hand coldness? No, doctor, I have no symptoms suggesting hypoglycemia. Can I examine you? Before I examine you, what is your job? Social driving, so as to not forget anything behind me. What is your job? How this disease affecting you in your job and daily activities? Do you drink alcohol if I need it? Do you drive? Yes, I need from you right now to stop the driving, then go to examine. Then I will start. Focus with me here. I will start here. If there is vision problem, it is better to start by what? By vision. Focus with me here. With me up. I will go to the vision. Number 1, by visual acuity. Excuse me, boss, I need a Snellen chart to assess the visual acuity. If they said no, then I will start for him. Please close this eye. How many fingers? Close this eye. How many fingers? Then I will sit in front of him. Visual field. Close this eye. Then please follow my finger wigglings. When you see my finger wigglings from outside, let me know. Do the visual field quickly. Then after that, say to the examiner, I need to do fundoscopy. He will say to you, no, need shift immediately to yourself to the pulse. Then I will come to the pulse to check the pulse of the patients. Here, focus with the rhythm, don't focus with the rate. Because any patient having transient problem in the basis, Irish, Arab board, MD exam, any exam, transient head, transient loss of vision, transient syncopal attack, dizziness. In post examiner, if you did not put your hands into the pulse, I will put it for you in the feedback. Pulse, carotid bruit. Syncope, dizziness, transient loss of vision mean pulse, carotid bruit. Then I will go for mitral area, tricuspid, trilateral quickly, tricuspid, pulmonary, and aortic. Then after that, immediately I will do a full neuro. I will say to the examiner, to the patient like this: pull in, out, do like that. Then at least to rule out any neurodeficit signs behind this dizziness, or behind this syncope, or behind this transient loss of vision. 2 minutes remaining. What is wrong with me? Is it a stroke? I highly appreciate your feelings. I highly appreciate your concern. From what you said to me, and after I examined you, most likely you have condition called, most likely this is mini stroke. Mini stroke, what we call in medicine Amrousis fugax, a medical term for medical condition in which there is blockage of one of the blood channels supplying your eyes due to shooting of blood clots, because you have abnormal heart racing, might be shooting of blood clots, blocking one of the blood channels supplying your eyes. That is why. What we need to do now is to do some blood tests, some heart tracing, and even we need to do some imaging to confirm our diagnosis and to rule out the others. In the time being, we need also from you to stop the driving. Then we'll discuss the proper plan of management later on. Is that clear? The examiner will ask you what is the finding that you got it inside this patient. On examination of this gentleman, he has got irregular pulse, being in atrial fibrillation at rate of around 80 beats per minute. Apart from that, I couldn't appreciate any neurodeficit signs. You with me now? And I couldn't get any eye problems. Examiner, he will say to you, what is the differential diagnosis of transient loss of vision in these patients? Number one, wallahi, because could be Amrousis fugax, or could be migraine or temporal arthritis, but again that patient has no any headache, could be a part of TIA, could be hypoglycemia, even could be MS, could be multiple sclerosis. Did you rule out? Yes, I rule out. I ask from any weakness or anything. Is that clear? What investigations you would like to carry out apart from basic investigation, CBC, RFT, LFT, electrolytes? I will do for this patient the following. So focus with me. In the heart, I will do what? ECG and 24-hour ECG. Am I right? Holter monitor, ECG, Holter monitor, carotid, Doppler, and CT scan done by the neurologist. Then also I will do investigation for all risk factor: fasting blood sugar, hemoglobin A1C for diabetes, and lipid profile for hyperlipidemia. And then also I will do checking the blood pressure, and I will do thrombophilia screening. Thrombophilia screening if I suspect that factor 5 Latin deficiency, as you remember, and protein C, protein S, and thrombin C. If you remember these issues, I hope that is clear. Clear? Yes. Yes. Thank you.